Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We have lots of things on our body that are very precious to us, but I don't know if eyes are not probably the most precious. And because of that, you have to take care of them. You have to make sure that you go to an excellent ophthalmologist at least once a year to check them out. And we feel that we have found someone who really can help you. Her name is Dr. MONIQUE Barbour, B-A-R-B-O-U-R, and she is a prominent South Florida ophthalmologist specializing in cataract surgery. But, of course, as an ophthalmologist, she deals in so many other vision challenges. And we thought that today we would talk a little bit about dry eyes, because a lot of people we'll talk about dry eyes and glaucoma, but dry eyes is something that maybe people don't even know that they have. So welcome to our show, Dr. Barbour, and let's see what we can do for the new year and get someone some help.
Absolutely. Thank you so much for having me, Anita.
It's a pleasure.
I'm so excited to be able to speak to your audience today.
Well, we're so happy to have you. And, of course, for people who don't get a chance to hear this, they can always get on YouTube and be able to hear the whole interview. So tell me about dry eyes. Are there things called wet eyes, or are they just things called dry eyes?
Well, actually, dry eye syndrome, as we call it, is a complex of symptoms and signs that we hear about most of the time from people that are out and about doing their everyday activities. Let's go through some of the symptoms. Most patients that experience dry eye symptoms will usually complain that their eyes feel sticky and that they might look red when they look at their eyes in the mirror. They may also complain of a gritty sensation or burning sensation of their eyes. Surprisingly, Anita, a lot of people complain that their eyes are tearing a lot and making a lot of water. And this is also a symptom of dry eye. Actually, what happens is the larger gland that's responsible for emotional tearing then takes over to supplement the baseline tear that's missing. So we have a myriad of symptoms that the patient will complain about before they get to the office, or when they get to the office. Their top complaint when they have a dry eye diagnosis is a gritty sensation or tearing, excessive tearing.
So what causes dry eyes? I mean, does it happen one day, or?
Well, it's multifactorial, like most illnesses. But I think one of the top things that we have to consider right now is something we call digital eye syndrome. And this is a situation that is affecting young people as well as older people. It seems that most of us are spending a lot of time on our personal devices, cell phones, iPads, tablets, laptop computers, video games. These activities sometimes force us to constantly stare at a screen, and without knowing it, our eyes are just not blinking enough to refresh the tear film. And so what happens is that the tear film becomes evaporative, and it disappears faster. And the eyes are suffering from this. Most people will complain at the end of a session of, laptop use or cell phone use even. Their eyes feel dry, or they begin to have the burning sensation. So I would say that is probably the number one cause in today's general population is overuse of their personal devices. Other things to consider, Anita, are medications. Medications are causing dry eye syndrome as well. One of the most commonly used medications for high cholesterol, any of the statin drugs, those can cause dry eyes. Any of your antihypertensive medications, hydrochlorothiazide, can also cause dry eyes. There is also medication for osteoporosis that does cause severe dry eye syndrome as well. there is a complex of illnesses and comorbidities that are responsible for dry eyes. Also, I would say hormone changes can cause dry eye. As we get older, our tear film changes, our tear productivity can change as well. So hormones can fluctuate and cause dry eye also.
I'm writing all this down. This is amazing. This one little subject, dry eyes. But if someone's having this from, let's say, medication, I mean, they shouldn't stop medication. I mean, which is more important?
Well, what we suggest, if it is due to medication, is that the patient may sometimes be able to make an adjustment, maybe reduce the dose of their medication that is offending, or quite possibly switch to a different medication altogether.
That's really, I guess, up to you as the physician to analyze and then to make suggestions.
Exactly.
Well, when you hear of dry eyes, you think that things are just dry, but it sounds to me like it's almost wet eyes, in a sense.
Right, because what happens usually is the gland that is responsible for making your emotional tear will take over and overproduce tears. So a lot of people will actually have tears running down their cheeks, and it's not because their eyes are wet, it's because they have a baseline dry eye problem that is being compensated with your emotional tear production. Now, dry eye can also be caused by other medical conditions. There is a condition called keratoconjunctivitis sicca, and it is a condition that results in a decreased production of tears. This is an autoimmune disease, in which antibodies will attack your body. Antibodies that you're producing will attack your own body. And keep in mind that exposure to smoke can also be a factor. One thing also important that I should mention is patients that have had LASIK surgery in the past are at risk for dry eye syndrome as well.
Wonder if they're ever told that before they have the LASIK surgery.
I believe most of them are, and a lot of times what's done is the doctors will put in something we call a tear plug to treat prophylactically for dry eye symptoms that may occur in the first couple of months following LASIK surgery.
This is really astonishing when you think of it. It seems like it's such a simple problem, but yet the pharmaceutical companies have been making medications, and physicians have had to learn what to do with them. And what if someone just doesn't do anything about dry eyes? Can it turn into something more serious?
Well, it can cause fluctuations in your vision. These are the symptoms that most people complain about also are fluctuation in the vision. But what can usually happen is the condition can worsen to the point of having a chronic problem where you may need to use drops constantly, or you may need to take a prescription medication to treat dry eye. What we look for on examination when the patient comes in for a dry eye evaluation is changes on the surface of the cornea and the conjunctiva. We notice actual small, tiny, dry spots, or we may notice that the tear film evaporates very quickly. There's a test called the Schirmer's test also, where we use a small strip to quantitate the production of tears. So that lets us know if the tear film is being produced in an adequate manner.
There's some people who, and you're using the word emotional film, emotional tear duct.
Yes.
So
no, an emotional tear.
Yeah, emotional tear. So
Yeah.
is it possible that someone who can't cry has a problem with their tear duct, their tears?
Someone who cannot make tears?
Yeah, they can't cry. Or is that emotional? They just don't have enough
I think
emotion.
that's just emotional.
My mother used to say, I can't cry.
Ah.
And I didn't know if that was...
I think it's just emotional because
I
we
see.
all have a gland called the lacrimal gland, and it's responsible for producing tears. Unless you develop some kind of malignancy of that gland,
Mm-hmm.
you should be able to make tears.
Okay. Now, we all have pets. Can a pet have dry eyes?
I think pets suffer with some of the same ailments that humans do, so I would have to say yes. I saw a guinea pig recently that had pink eye, and I treated him.
No,
with
you didn't.
medication.
They brought their guinea pig in for you to treat?
With the same medication, and we got better.
Oh, you are so good. Now, that's a good one. That's right. We ought to advertise. If you want your guinea pig treated for right. That's very cute. Well, only you would do something like that. I love that. Okay,
Yeah.
but don't bring your turtles in, please. Right?
Exactly.
Okay, well, I think that's a great discussion to have on dry eye. I think anyone listening, if they are having a problem, may I suggest that you give Dr. Barbour a call and call her office and make an appointment. The number is 561-432-4141. Again, that's 561-432-4141. And make sure that you go in and get that treated. And if you want to get on their website, it's clearviewnow.com. That's VUE. So it's Clearviewnow. ClearVuenow.com. And they're located on Lake Worth Road in Lake Worth, toward the west. And that's important. Go do it and get to meet Dr. Barbour. She's a charming woman, and she will certainly give you an exam. How often should people come and have a yearly exam? I mean, do they come a year? That's interesting. A yearly exam, right?
Yes, indeed. Most people will come in for the annual checkup, and once we initiate that, if there are any problems found on that exam, we then schedule testing and a follow-up exam for treatment and planning. One of the top treatments now for dry eye is we start with artificial tears, and omega-3 fish oil capsules are highly recommended as well. But if the patient fails, treatment on that therapy, we then have small devices we can put into the tear duct called punctal plugs, and they work marvelously at treating dry eye. Further, there is a device now called LipiFlow that massages the eyelids and helps with the tear film production. So we are now beginning to offer this treatment in my office. It's called LipiFlow.
This is it's not a subject I would think there'd be so much information on, but you are really a specialist in this. This is great. So
Absolutely.
You can help people with any of this. So this is just absolutely wonderful. Plugs and all sorts of things. So please, everyone,
Exactly.
if you have this problem, go to someone who really seems to have met with the challenges of this and knows everything that you can be helped with. So I'm very appreciative of this discussion on this. So now maybe we have gotten people interested enough to say, all right, so what other things should I be worrying about? And of course, we all know that glaucoma can lead to blindness. So we want to take care of that before anything happens, don't we?
Absolutely. Glaucoma is one of the most prevalent illnesses in the United States, and it's one of the most leading causes of blindness in the African American population, especially. So I think everyone over 40 should be screened for glaucoma, and especially if there's a family history.
Well, when people come in for a whole eye check, do you just normally screen them for glaucoma? That's just part of it?
Yes, that's part of the eye exam. It's part of a complete eye exam. We check the eye pressure, and the retinal exam includes a look at the optic nerves as well.
Okay.
So we do a complete screening for glaucoma as well as other problems.
So what causes glaucoma?
Again, it's one of those multifactorial illnesses, but I would have to say the most prevalent risk factor is family history. So if it runs in the family, you're definitely at high risk. Again, it's one of those illnesses that can pop up out of nowhere. And we call it the sneak thief of sight because there are no symptoms. And it slowly takes away the vision.
So the only way someone will know is if they have an examination from you?
That's right.
Wow.
They come in and get screened. Mm-hmm.
Now, what does diabetes have to do with this, with glaucoma?
Diabetic patients are at risk for glaucoma. I think it's not necessarily based on having a high pressure in the eye. Rather, it is mostly associated with reduced blood flow or ischemia to the optic nerve. So that over time, with the blood not being able to reach the optic nerve in the capacity that it should, the optic nerve cells then kind of die off. And that is a kind of glaucoma. And quite often they will have low pressure on the eye. They won't have any pressure at all on their eye. So they will have something we call normal tension glaucoma.
So what is the proper pressure that someone should have on their eyes when they're tested?
Normal intraocular pressure is measured in terms of millimeters of mercury. When we measure the pressure, the method that I use is called applanation. It's a small tip that touches the cornea, and a prism reflex is then balanced to gain the accurate number. So that number can be anywhere from, I would say, 10 to up to 21 millimeters of mercury. When speaking about glaucoma and the treatment parameters, we usually aim to lower the eye pressure by 30%. So we then will see the patient once or twice before deciding what their average eye pressure is, and then we start drops based on the average pressure and set a targeted pressure 30% below that average pressure.
So you start them on drops if you think that that's appropriate, and then they put them in both eyes. When you have something, is it glaucoma in both eyes automatically?
Most of the time, it is a bilateral symmetric illness, but occasionally we do see asymmetry where the patient will have it. One eye has glaucoma and one eye does not yet manifest glaucoma. But for the most part, it is bilateral and symmetric. So when we start medications, we start it in both eyes.
So when you are examining people, and someone you can detect that, you just start them on drops. Is there anything else you can do to help them?
Before we start drops, occasionally we always complete testing. A sketch is made of the optic nerve head, like a drawing, and as a reminder of what the optic nerve looks like before treatment is started. Also, we have a couple of other tests that we perform to help with the analysis of the optic nerve. The most important tests are the visual field test, and there's another test called OCT, which is like an ultrasound of the optic nerve. It quantitates the thickness of the optic nerve and lets me know, compared to a normal person, what the parameters are on a patient that has glaucoma. So we do these tests, and we kind of put it all together and establish a baseline for the patient, and then we start therapy.
That's very, very good. That really shows that you are very experienced at this, and that when someone comes to have an exam, that they can have full confidence in what you're going to do for them. So I have to reintroduce you again, Dr. Monique Barbour, who is a prominent South Florida ophthalmologist. And although she specializes in cataract surgery and she has some very special procedures she does, she's very interested in glaucoma, dry eye, and anything to do with vision. When you go to her center, you see a lot of people are there because I guess they found you. And it's called Clearview Center, CLEAR, then a VUE Center. She's located, the office is located at 7657 Lake Worth Road. And again, you can call for an appointment at 561-432-4141, or you can go on their website, which is clearviewnow.com, CLEARVUENOW.com. You have a very strong older adult patient load. I see them as they're in there, and I'll bet that they come in there because they respect you and they want their eyes treated, but they also want to talk.
Absolutely.
You're a good
and
listener. You're a good listener.
Let me add, Anita, that I am also a fellowship-trained glaucoma specialist. And what that means is that I've done an additional year of glaucoma training that allows me to be able to perform a higher level of glaucoma care and surgery. So I'm trained to do small incision glaucoma surgery and use the latest devices and techniques to treat glaucoma.
That's great news. That's excellent. I'm glad you mentioned that, because if you don't have the extra training, it does leave some facets undetected. I mean, that's why people go for extra training. And so I'm glad you did mention that. Right. Well, I think that as we have more of an aging population, you can see they're growing leaps and bounds. And I like that, thank goodness, because I've always been involved, of course, with the seniors. But it's going to require more people like you to be able to take care of them and think about what their problems are and to understand them, not just to load them up with medication, but some of the new procedures that you have been talking about, which are quite good. Glaucoma is something that people want to take care of because, unlike dry eye, I don't think you're going to go blind from dry eye unless there's some other things happen. But glaucoma is something that could be very, very serious. So make sure you go at least once a year to see Dr. Barbour. But if you're an older adult, I don't know if you agree with this, but once you're over 60, 70 years old, I think you should go twice a year for your vision.
Absolutely. That goes without saying, because naturally it's going to be fluctuation of your vision, not only to check your glasses, but to also be screened for some of the other illnesses that might ensue.
Right. Well, you've also talked about some very unusual tests that I had not heard of before. Can you just do that right there in your office, or you're not doing surgery for cataracts in your office, are you?
No, I'm not doing cataract surgery in the office. It has to be done at a surgery center or at the hospital because it requires sedation. Even though I do surgery with eye drops that numb the eye, that's considered topical anesthetic, we still administer an IV sedative so that the patient can relax. Yeah. But prior to the surgery, we have to do all of our testing is done in the office. We do all of the calculations so that we can decide which implant is best for your eye.
Yes, we talked about the implants. So you have to. There are more than one implant. Is what you're saying now.
Right, and absolutely, there are always newer implants coming onto the market, and just been learning now about a new implant which is now available that corrects both your astigmatism and helps you to read as well. So it's truly a phenomenal device is now available. It's called True Line, as a matter of fact, true line. And it is available to correct everything. It's just a phenomenal device, and I look forward to being able to choose the right patient for that particular implant.
So it's not for everyone, is what you're saying.
Exactly. But we do have options. We have something for everyone.
Yeah, well, that's very, very important. And years ago, I'm getting into the cataract for a moment, people used to have to say, well, are they ripe yet? What did that mean?
I think it means to most people, is your cataract keeping you from seeing well, even when you have your best glasses on? That's what that means to me. And if that is true, then it is time for you to consider having cataract surgery.
Mm-hmm. And you have to really have someone who understands that. You can't decide yourself, or your friend says, yes, it is. You have to really have an expert who's been dealing with this. And so I really do hope that you will go and make an appointment with Dr. Barbour. And it's how young are people when they have cataracts? I mean, is it always that they have to be 70 years old?
Not at all. I'm seeing patients that are younger and younger. And again, cataract development it's multifactorial. It can be something that runs in the family. It can be traumatic cataract. It can be something that you're born with. Or it can be an age-related cataract. So we're looking at all these different factors. And usually if it's a young person, it's something that has run in the family. But most of the time, if it's an older person, again, it's going to be age-related cataract.
Right.
So I see a variety of patients.
Well, we have a lot of topics to cover, and next time we have you on, we'll think of something else that's been so helpful. But today we had good subjects on dry eye and glaucoma, and we want to thank you so much and wish you a very happy New Year. And thank you for
Anita.
being
happy
on with us. Yes.
To you as well.
Thank you so much, Dr. Barbour. Goodbye.
Thank you. Bye-bye.